As the country strives to flatten the COVID-19 curve, 124 more people have tested positive for the virus, raising the infection tally that has already surpassed the 2,000 mark. The government says the 124 were part of 2,640 people whose samples were tested in the latest tests conducted.
The positive cases include 119 Kenyans, 2 Somalis, 2 Tanzanians, and 1 Eritrean national. These figures do not include the number of foreigners we have tested at the border and turned them back to their countries. Mombasa had the highest figures today, standing at 40, while Nairobi at 38, and now Busia at 26. You can see what I'm talking about.
And as the numbers continue to grow, Elgeyo Marakwet now joins the list of 35 other counties out of the 47 where the virus has spread.
In Mombasa, the 40 cases that were there, out of the 40 cases, 14 of them are from Mvita. Again, the same thing. We have 14 from Kisauni and 11 from Changamwe. The same trend again in the same areas. In Nairobi, we have 38 cases from Kibera, 25 from Kamukunji, and 25 and the cases from Kibera, a lot of them are in the quarantine facilities. 25 from Kamukunji as well.
The government says the border points remain a threat to the fight against the virus, with all 26 cases captured in Busia County being truck drivers.
We have, however, noted that a majority of the truck drivers are commencing their journey to the borders without this valid document, expecting to be tested at the border points. This has resulted to unnecessary congestion and delays that have been witnessed at our border points. This is purely indiscipline, which is unacceptable and will not be tolerated. I'm urging our law enforcement officers to take appropriate action against each such driver flaunting these measures.
And in a bid to boost the county's preparedness by having the necessary infrastructure in place in the wake of the pandemic, the government has disbursed a conditional grant of 5 billion shillings to all the 47 counties.
It is now up to the county governments to utilize these funds to safeguard the lives of our people by ensuring that our local health facilities are well equipped and our healthcare workers are adequately catered for. If our counties are fully prepared and have the necessary infrastructure in place, then we shall have nothing to worry about. However, we all know what happens when the reverse takes place.
This even as 4 more people lost the battle to the deadly virus, bringing the number of COVID-19 fatalities in the country to 78. Gloria Milimu, K24 Evening Edition.